Innovation in Technology and Healthcare Final Project, How to Decrease Long Wait Times in the ER by Lindsay Jones. Almost everyone in America has been in the emergency department. In fact, 136.3 million people visit each year. Usually the circumstances are not pleasant ones. I first did research to identify many factors contributing to long wait times. The main problems I saw were staffing, communication, different levels of care, flow of the emergency department, and our triage system. I then wanted to look at what solutions to these problems were already out there. These included physician model, making reservations in the ER, medical screening model, fast track systems. While all of these were great ideas, they all had some problems. I wanted to propose some solutions to my peers to get feedback. The first one I proposed was public service announcement, then the triage system process, then the communication ban. After collaborating with my peers, I decided the best solution would be the triage team process. The triage team process is when I took two solutions that were already available and made it into mine. Emergency departments who implement the triage team process would decrease the long wait times which are causing negative effects on patients, healthcare providers, and hospitals. How the triage team process works is simple. You, the patient, would arrive in the ER and sign in. Within 30 minutes, you will be seen by the triage team, which consists of a physician, a nurse, and a nursing assistant. After they assess you together, they will decide what level of care you will need, and you will go to that level of care. If they decide you do not need any further care, they can discharge you right from triage with prescriptions and discharge instructions. This process will help the quality of care that patients are receiving. Patients will get 3 medical professionals triaging them. It will expedite patients to the level of care they need, lower frustrations patients are feeling, have more resources, improve the quality of care the staff can give, better department flow. This ties into the efficiency of care. The triage team will see patients within the first 30 minutes of them arriving to the ER. The triage team can get a lot of the initial testing done right there in triage, and the physician can review it. They can also give medication for ailments right there in triage, so if there is a wait, they are at least comfortable. Patient safety will increase if this process is used. There will be more staff and more resources, resulting in less symptoms missed, less errors made, less patients leaving without being seen, and less fatalities. A published article from the Annuals of Emergency Medicine showed long wait times can lead to more deaths in patients seeking care from the ER. Using this process, patient outcomes overall will be improved. Patients will see a physician faster, receive faster care, faster resolutions, less stress for the patient, taken care of in a timely manner, less risk for patients' condition deteriorating while they wait. Unfortunately, there have been cases of patients dying in emergency rooms. The average wait time is 3.3 hours to be seen. To get all of these positive outcomes started, we need to plan to get this process mainlined to the ERs. Most ERs are already equipped with physical resources such as the triage area, fast track departments, and the ability to print scripts. The additional physical resources would be the actual triage team, which consists of the physician, RN, and nursing assistant. Once the hospital have all the resources in place, they would need to get a written procedure done. Most likely, it would be written by ER physicians, nurses, and administrators. Next, you would want to train your emergency department on how to properly implement these procedures. After all of your resources are in place, you would probably want to advertise that your emergency department is using this new policy and procedure. Then you'd want to have a trial period for about 90 days, which will allow the ER to collect data. Once the data is collected, you can adjust the process accordingly. In conclusion, I believe this process could be a game changer in the world of emergency medicine. I'm very passionate about improving patients' experiences, and the emergency department is the first place in a hospital a patient sees. Improving that will allow the patients, healthcare providers, and hospitals to achieve their goal of better, safer, and faster care in the emergency department. If you would have told me 7 weeks ago that I would have come up with an innovation to solve a problem of long wait times, I would have told you you were nuts. This course has given me the knowledge on how to come up with an innovation and then implement them. I guess you can now say I'm an innovator. This is my elevator pitch. You're making a great dinner and bam, you cut yourself with a knife. Your family doctor is closed, but you are bleeding a lot. You're contemplating what to do. You are concerned about the cost and if there will be a long wait time in the ER. What if you had another option? In your local ER, you have the triage team process. You arrive to the ER and immediately you are seen by a physician and a nurse and a nursing aide who will assess you quickly. They can decide right then and there what services you need. They can also discharge you right from triage. It takes the stress and guesswork out of, do I really have an emergency? No other ER systems has a nurse and physician triaging the patients together with the ability to discharge right from triage. This will save you time and money. If you think your local ER can benefit from the triage process, let us know. We'd be more than happy to come and present our idea to your ER. Thank you very much for listening, and these are my references.